All right, so this is
Sounds good.
our parent education series. My name is Jeremy LaDranca. I have a master's in education. I'm a behavioral analyst, BCBA at Health West. I work in the autism program. And my co-host today is,
Hi, Irene Blair. I am a supports coordinator here at the autism program at Health West.
wonderful. This is just one of the several different parenting series that the autism program is putting on. Specifically, this is not only for children who have autism. This is for any children specifically, and I think that you'll see as this would be very pertinent information to work, just for adults, almost the same as it is with the children. So we're gonna throughout this presentation, we're going to talk about a lot of different things. We utilized a couple different online videos that were given by medical doctors in their training sessions. They were training some other doctors, and we're going to utilize some of that information. So the stuff that we cite, a lot of the slides are going to be extremely familiar. I cite the resources at the end of the slideshow. I do very much encourage you to go and watch those on your own time. Each of the videos, the main ones that we got this information off of, were about 2 hours long. I'm sorry, they're about an hour long each. So if you're to watch both, it'd be about 2 hours. And one was specifically regarding kids with autism, and the other one was just a common overall sleep. We're going to cover children ages 0 through 10 years again on here. Again, but a lot of it is going to be the same repeated information as you will see. So I know that there's a lot of stuff going on right now with the COVID pandemic, with adults not getting sleep, with having, waking up with some vivid dreams and a lot of other different things. And we're going to try and cover that in here as well. So here we go. All right. So let's take a look and learn how to use the slideshow thing here. So before you start tackling sleep, right? You have kids in the house. I'm sure that not I'm sure, but I'm guessing that all of you are doing the absolute best that you already can. And I'm not here to say that I'm the expert. I'm here to say, and Irene, we are not here to say that we are the experts. We are here to show you just information that you can gather online. We do feel specifically in ABA that we use more research-based and evidence-based practices. There's a ton of information, and if culturally, if you're more homeopathic, there's always going to be those things out there that you firmly believe in. What we do encourage you to do is at least take a look at some of what we have to say and maybe find a middle ground, or maybe consider how some of what we're saying you can adapt into your practice to see, if there are definitely issues, at least you can look into something like this where it's over and over again, it's shown to work. And we're going to give you, several different ways to kind of look at that. The biggest thing, as I'm working with any of my families that I do in ABA, it's always going to be a team effort. This is not going to be mom's handling it. This is not going to be dad's handling it. It might be, one parent is working more than the other. And the first thing that you guys are going to need to do is get on the same page. Before we start tackling this, are we in agreement on what's going to work, right? Because you're going to pick a plan, and if one person is not doing their diligence in that plan and being consistent, the plan's going to fall apart, and it's going to look like the plan was the issue versus the consistency is the issue. So I would definitely say, talk to your spouse, significant other, anyone who's assisting in caretaking, if kids are traveling to stay with grandma, grandpa, if older siblings are assisting with this process, it's going to be all hands on deck. And the good news is that most of the interventions, minus something that's medical, are more than likely going to be, hopefully solved within a matter of days. And then, at the longest, I do believe that of the several different interventions we have here, the longest intervention may be lasting about 2 weeks, maybe 2 or 3 weeks. So if you kind of look at that, what I would encourage you to do is go all in with at least one, or a couple of the different things. Give yourself a solid plan, and definitely don't throw the baby out with the bathwater. try to itemize things, try to look at things. What didn't work this time? Are we being true to what we're saying we're doing? Or are we still just kind of trying as hard as we can and kind of flying, by the seat of our pants a little bit, which again is okay. And there's different stresses and situations. Tackle what you think is going to work, but make sure that you're aligned on how you're doing it. Okay. This can be absolutely exhausting. I have 3 kids of my own. I know Irene has children. We've gone through these. I can tell you that again, I'm no expert. I've done a multitude of different things, and I can tell you what worked for me. But I can tell you, at the basics, there are some common things that we can definitely do, no matter what situation I think you're in. You want to model appropriate behavior. If you're not getting yourself, if you're not in position to, I think one of the old sayings is you can't help someone else if you can't take care of yourself first. If you're modeling and you're getting good sleep behavior, you can utilize from your own experiences, from your own seeing what works with you, what doesn't work with you. You can do that, getting yourself on a good sleep pattern. If mom and dad are up all night because they're not sleeping and there's lots of noise in the house, or there's siblings, those are going to be the things. We need to make sleep time everyone's sleep time, and we need to model that. Otherwise, your little one, no matter how small, I guess as long as they're able to conceptualize it, they're going to notice that there's fun going on, and they're not going to want to be asleep. So we're going to cover some of these things again. Think with the end in mind. Sleep behavior is taught. It is not natural. Kids are not born good sleepers. I know that is something that we hear. That's something that kind of feels good. I think, for those of us who have good sleeping babies, that might feel nice. Oh, they were just born that way. I would definitely argue that and say this is something that is taught, and this is their modeling behavior that they are learning from you. Now, again, there are children who are born with high anxiety, with a lot of internal things that we cannot see. So I say that behavior is taught, it's not natural. However, there are some different things that we can't compensate for. And this is where we are definitely, Irene and I are going to heavily defer to the doctors. We do not want you leaving this presentation saying, well, Jeremy and Irene said, do this. We're definitely not saying this, okay? Skills are learned through motivation, giving them reason to go to sleep, right? How do I make the body want to go to sleep? And you can do this for several different ways. Consistency. Weekends, if you're working on a sleep program, weekends aren't your days off. It might be nice. You might be able to stretch something maybe within an hour or so, but routine is going to be your biggest thing, especially if you're having problems with Mondays. That is a sign that maybe the weekends are throwing your body, your circadian rhythm off, and that is your body, you start to get your body in the motion of waking up early, being a night owl, and all of a sudden, before you know it, if we're looking at my phone a couple nights a week, now I'm finding out that more often than not, I'm waking up more in the middle of the night because I'm training my body to do those things. And then reinforcement. Once we're doing things with the baby, I say, we're all talking with all ranges of children. What type of reinforcement is there for them to put in that work to do the sleep schedule, right? What kind of reinforcement? What's in it for them? You will have to change your environment. If it's not working, you will have to make some changes. This is not something where other people are going to do, help your baby get to sleep. This is what are you going to do? You may have to talk to your doctor for assistance, and that's not, I'm sure all of the doctors include that in the well baby checkups. They include that in those conversations. So be honest when you're meeting with your doctor or when you're talking with your spouse about everything. If you say, well, you know what, our environment is great, there's no sounds, there's no music, make sure that that's actually happening. And if you need to, get a piece of paper and kind of write down in a journal. I know that when a lot of diet programs have, food journals, write down exactly what you're eating so you can see some of that progress. So you can be honest with yourself and you can see some of the growth, or you can also see some of the things of, oh my gosh, I never thought about that. Maybe this is getting in the way, right? Okay. So planning, taking a look at things one by one. Bedtime routine. Do you have one? Right? That's the first thing. Is there a bedtime routine? Is there a routine so much that you could tell somebody, here's exactly what we do? Or is it we do the best we can when we can do it? Again, no judgment zone. Most of the time, if I'm in a hurry, it's exactly what it is. If we're going to be focusing on a sleep schedule, though, this is something that we're going to have to set into place. We're going to have to make a very conscious effort to do. Dinner. We want to know, the routine is not just 20 minutes before bed. What is happening from dinner all the way until that you want your child to go to sleep, right? And we're talking infant all the way up to teenager, even maybe adulthood. Environment. What cues happen? What are some different variables? If I'm getting ready for bed, do I see people start to get in the shower? Do I see getting their jammies on, brushing your teeth, lights down, story time? All these are cues that, it's time to start getting ready for bed, right? Variables. What else is happening? Maybe if I'm in a high noise environment, what else is going on? Maybe I remember when I was younger, there was a train that came by at like 10 o'clock, Are there church bells that go off at a certain time? Are there different things that you can see or kind of help cue into that could assist you in creating this routine? I did want to mention that co-sleeping under year 1, and there's a whole medical thing regarding SIDS and stuff, but I did want to mention that, that is unsafe under 1 year of age, okay? Sleep schedule. Do you take the weekends off? If you do, that will throw off your rhythm, right? And I think as an adult, if I'm having a rough Monday morning, probably indicative of, did I sleep in on Saturday and Sunday? Did I get less sleep on Saturday, Sunday? Did I not get exercise? What did I do, during that time? Physiological sleep disorders. Again, these are more medical, but we didn't want to mention them because some people might be looking for some answers there. Again, we're not the experts here, but sleep apneas, restless leg syndrome, narcolepsy, those are some of the things that we'll talk about. And then developmental history. Some do not recommend sleep training before 4 to 6 months. I know that one of the videos does say that. So, if you're kind of in that 4 to 6 months, use your doctor, use some of that best practice that your pediatrician is providing for you, or other resources that are well known, well respected to do that until you hit to that 6-month marker. Family history and culture. There could be some medical problems historically in your family. Could be, some sleep disorders. Do you, as the parent, have sleep disorders? Are you, up all night? Do you have some things that need to be considered before, really pushing forward and making a plan for your children? Developmental disorders, right? Do we need to conquer some other things first and skill build before we can just expect the kids to kind of naturally do these things? Remember, we talked about sleeping as a learned thing, not a natural thing. Parental anxiety or mood disorder. Okay. Do we need to, again, we're talking about that self-care. Are we taking care of ourselves first so that when we're responding to the child, when, we're going to talk about later, not adding attention and being calm and in a good position to respond to your child who's not sleeping? Are you able to do that? Or do you tend to, let your emotions get the best of you a little bit? Medical factors, some of these things you're going to want to take into consideration. If your child's in pain, I can't sleep if I'm in pain. If my legs if I'm just sore from the night before, I'm just tossing and turning, those nights are going to happen, right? We need to take that into consideration. Teething, reflux, eczema, epilepsy, neurological disorders, inner ear diseases, otitis, I believe that's called. And then some medical conditions may be worsened with increased crying and anxiety. So this is going to be something you want to have a good handle on before you launch into something. See video, the common sleep problems in children. That's attached to the very end of this presentation. You can check those out. I do very much encourage you to do that. That doctor on there, he talks a little bit more in depth on those, okay? And then consult a professional regarding if if there's severe anxiety or there's trauma in your child or in you or in anything in the family. You want to make sure that that's taken into consideration before you jump into this. Okay. When to talk to a doctor? Pretty much anytime, right? Anytime you want to get medical, you want to get go to someone that you trust, that you're going to. If you're looking online, if you don't have a doctor readily available, there's always probably resources out there for you to go and to consult with. There's a link for Health West. You can, there might be some ideas and some things in there that would come from medical professionals there. If your child is routinely snoring and looks tired or fatigued, looking tired after you had a long day playing all day might be one thing. But if it's regularly happening, you're seeing, bags under the eyes, are looking frail, they're just lethargic, you might want to check with your doctor. Occasional snoring is Not usually an issue, but if it's routine snoring, mouth breathing, you're seeing things like gasping for air, you're hearing some things that are just a little bit concerning, I would definitely talk to your pediatrician. If your child's routinely having night terrors, night terrors are a little bit different. We'll get into these. They are not nightmares. These are night terrors. If you're seeing this readily happen, we're going to have to maybe talk to a professional. If your toilet-trained child regresses and begins to routinely have bedwetting, bed soiling issues, you're going to want to talk to your doctor. I'm getting really happy wheel here. Okay, so sleep training results. What you're going to see, if you dive into it and if you follow best practice, the evidence is very clear. You are not going to be mean and create abandonment issues with your child. Okay, if you follow what we have here, if you follow some of these things that are, proven and scientifically based. Okay, they've done lots and lots and lots and lots of studies at the 1 year check-in that people who did run these programs versus not, there was not any abandonment issues whatsoever. In studies, sleep training can result in falling asleep faster, waking up less frequently during the night, lower cortisol levels, which is stress. So we think, oh my gosh, I'm going to be mean to them and make them cry and do all that kind of thing. After that first buffer, right? We're talking, this is about the year check-in. The stress is less. They feel better. They've kind of resolved that issue. This isn't going to go away overnight. This is not going to be easy. We're going to push through it. And in the end, it's kind of like it gets worse before it gets better. Decrease maternal stress, right? I would say decrease marital stress. This wasn't part of their study, but I would say if mom and dad are not having to wake up in the middle of the night and they're not arguing about different things, things are just going to go a lot nicer. Or whomever the caretakers are, right? No changes in attachment or emotional problems at the 1 year follow-up, what you're saying. Okay. What is sleep? Sleep is a physiological process that involves actions throughout the day and into the night. It's fluid, right? Sleep isn't just something that happens between, if I'm going to bed, I shut my eyes here and then I wake up here. That's not your sleep. Sleep is more, 24 hours. What did you do beforehand? Did you get the right exercise? Did you eat enough? Did you have a routine, right? And then that kind of is determination and determines what type of sleep you're going to have during the night as we think about it. Our body naturally produces melatonin. Our goal would be, how do we help our body produce this melatonin in its natural sense? Are we doing anything to prohibit that, which might make it harder to get ourselves to sleep? Or are we doing things that assist it, and we're kind of at our best? Motivation needs to be taught. We teach them how to get through this routine over time, right? And there's a couple different phases of sleep. We have rapid eye movement. This is where our memory and learning happen. Dreaming and nightmares, that happens in our REM sleep. So 50% of infant sleep is REM sleep, and 25 to 30% of sleep with adolescents and adults. So obviously our REM sleep goes a little bit down depending on, as we get older. And the non-REM sleep, this is the growth, the sleep waking, and the night terrors. This is when this happens. If you've woken somebody up, I don't know if it can be a little bit comical, can be scary, I guess, with the night terrors, but someone just kind of waking up, having a conversation with you, and then walking off and going to bed, and then you talk to them in the morning and go, hey, do you remember this? And they're like, no, absolutely not, right? That's kind of what we're talking about here. Okay. Oh, I just can't get it down.
Keep jumping.
Man. Irina, are you able to move this along, this slideshow?
It says I can. But,
okay, cool.
Oh, there we go. It's
Awesome.
slow. Okay.
Okay, perfect. Okay. The normal process. Sleep is a normal process. It's affected by our circadian rhythm. Motivation to get to sleep. Let's see.
All right.
Go ahead.
Did you finish yours?
Yeah, it advanced me through the slide. So
Okay.
There we go. All right. Okay. Sleep drive. This is frustrating. I'm going to get made fun of for this. So sleep drive, it's dependent on the quality and quantity of your previous sleep, right? So are you creating a situation that invites someone to be tired at the end of the night, right? regulates the depth and length of sleep. So that's going to be the biggest thing when we're talking about doing anything with sleep, no matter which action that we take. Our biggest thing is going to be creating that motivation. And that comes with behaviors, and it's almost with everything. You want to make it so that the body is naturally craving that sleep, and so it starts to get into that circadian rhythm. Okay, go ahead.
All right. What's it going to do for me? Okay. So helping kids sleep, one big first and foremost obvious thing is keeping them in their own beds. Um, you know, cribs are definitely a safety factor, but they are just really good in, allowing the child to have their perimeter, their space for sleep. We will kind of touch this as we go through the presentation continuously, but having a routine, the environment is part of that as well to make sure that a place for the child to sleep is exactly that. It's not a play place. It's not a watching the tablet or videos place, but it is a place for sleep. Um, and then as the kids grow, I think the biggest factor in my personal experience is once your child can climb out of the crib, it's time to move them out of the crib. Then we have toddler beds. A lot of cribs these days are convertible so that you can take the side off and have the crib to toddler bed, which is still their familiar space, their perimeter, their safe space. And then as they are used to not having that, full restraint, they have a little bit more freedom of movement, then they will transition then into beds, which often have very easy slide in bed rails for families who are concerned about their children who roll out of bed, or other issues there. Um, Jeremy already talked a little bit about co-sleeping and how that's not safe. And I will say, yes, my children climb into my bed very, very often at night. And after some, a hug and another goodnight kiss, they do go back to their own bed. They kind of need that too. The American Academy of Pediatric Medicine and the American Academy of Sleep Medicine have shared these recommendations for the best sleep as children age. I think that many parents are familiar with these or very similar ranges of sleep time. It is a pretty widespread, widely shared information, but it is important to know that nap time is a big part of the sleep time that we talk about. And obviously, that kids do need less sleep as they age, but kids still need a lot more sleep than maybe we are really consistently allowing them. The school hours, the getting homework done in the evening, getting the bath, the after school activities, really can cut into that sleep time. But we want to really work to make sure that our kids are getting the amount of sleep that's recommended. There are obviously outliers. There are going to be kids who don't need quite as much sleep. There are going to be kids who really want more sleep than maybe you would expect, but these are really good guidelines to go by as you are helping your child sleep. Um, So a little further breakdown to those totals for sleep. Newborn babies sleep all the time. Their bodies are still going through huge, massive growth. Brain is going through growth, and so they're going to be sleeping more than not. And it's usually going to be very broken up through the course of the 24-hour period. Infants very rarely sleep for periods of time longer than 4 hours. That's very expected, but we do want to make sure that our babies are having frequent naps and that they have that opportunity for their brain and body to grow and get that rest that they need. And then, of course, as they are getting older, they don't necessarily need to have that full belly before bedtime. And they may be able to have that longer sleep stretch during the night, but still having a lot of frequent naps during the day. Um, School age kids typically do not need regular naps. I know preschool classes, even kindergarten classes may have rest periods, may have you still bring a sleeping mat, bring a pillow and a blanket to school. And, sometimes those 4 to 5 year olds may doze off during that period of time. That might be a sign, again, that they're not getting enough nighttime sleep, or it just might be still their body needs that extra bit of sleep. And then as kids get to an older age, the nap times phase out, but they do still need to have that consistent full night of sleep. I like to remind families too that as you think about that period of sleep, it sometimes the family schedule, the routines. I mean, you could be concerned that your child is not going to bed until 10 or 11 o'clock at night, but then you let them sleep in until 9 or 10 o'clock in the morning. They're getting that full period of sleep. It's just not how you were maybe hoping that they would be. Other families may be, yeah, it's cool. This is our time together. We can stay up late and they can sleep early or sleep in later in the morning, or vice versa. I want them to go to bed early so I can have my quiet time in the evening, but then be prepared for your child to be up early and ready to go then too. Um, but ultimately, in that, you're going to see that consistent length of time for a sleep pattern. Um, the consistency, that routine, that following the same schedule each night is going to contribute more to having a full night's sleep rather than going to bed early. It's going to be, what is the total number of hours of sleep for this child, and are they consistently getting that every single night? Oh, lengths of naps. So again, like I said, as your very newborn infants, the younger infants, they're going to be having multiple frequent naps throughout the day. Those can be lengthy because again, it's going to be a period of time kind of close to what they're doing around the clock, 3 or 4 hours, and then they're going to have a few hours of wake time, and then they need to go back to sleep again. Jeremy and I, as we were preparing for this, he even talked about how there's the um, awake time, followed feeding time, and then nap time. And it's basically those first couple of months is going to be that around the clock. Awake, feed, sleep, awake, feed, sleep. And then as they start to get older, then the nap time decreases due to 2 to 4 naps a day, maybe shorter periods of time and during the day and longer periods of sleep at night. And then as kids grow, then that period of length of time, that nap time is going to decrease. Having that consistent bedtime and wake time, um, to be able to have your toddler get the amount of sleep that they really need to be at their best. You do want to have them go to bed by at least 9 o'clock, you know, but going to bed at that time really fits in then with the morning. Once we're all waking up, breakfast is made, we're getting ready for our day. That's going to meet that, length of time, the 10 to 12 hours of sleep that they may need, um, or more sleep that they need. Having that cue, part of the routine is going to usually starts from supper time. That we, from supper time, we're going through steps each evening to get ready for bed. And whether it's a family having story time, having a cuddle time, brush your teeth, drink your water, go to the bathroom, lights off. There needs to be a final note there in that song to say, okay, we're not, there is no more back and forth after this point. We're done. Um, it, the negotiation kids are really good at this, and they are charming. A child loves to have your undivided attention, and that this is where all of the curiosity, the mind is ready to just process the day. And so the really interesting questions start popping out. The how does this work and who does that and what do you think about this? And it's hard as a parent to say, we're not going to talk about this right now. I love that curiosity. I love that. It's really easy to get sucked into it. And you can say, hey, let's save this for tomorrow. We'll have a conversation about it, and then you can, stop. Um, people, I know that the bedtime charts are massively successful for some kids. I think my nephew started going to bed in his own bed by himself within a week once my sister put together a reward system nighttime chart. And he got to put the star on the box for every day of the week, and he got to pick out the prize at the end of the week. And once they were able to achieve that, and it was the first try that they were able to achieve that it was he was good to go. He knew what he was supposed to do for bedtime. That might be different for each family. Not every child is going to respond to exactly the same thing. There's no such thing as cookie cutter when you are raising children, but there is definitely a technique that you can pull together to meet the interests, the needs of your child that can work for your family too. Regression is so normal. This is when we have made the progress, we're succeeding, and this is all going well, and then it's not. And things are falling apart, and it's 11:30, and I'm at my wit's end, and the children are bouncing off the walls, and what happened? We had a good thing going, and it's all gone. If it's a one night shot, then sometimes that happens. We all have an off day, and just pick up the pieces, and the next day get back to the plan, get back to the routine, and things could be good. If it's not, maybe there is something going on in there that you weren't really able to anticipate. Is there a new noise outside? Is there something in the bed that's uncomfortable? Just really examine what you've been doing, and are there any changes, and try to bring it all back together, making as few changes as possible. You don't want to have to rebuild that whole structure, if there's something in there that it just needs a little tweaking, um, because those changes can disrupt everything that you've put together. You, it uh, Children they thrive on the routine. They need things to be predictable. Our kids love to read the same story every single night so that they have it memorized inside and out. And this is just the same as that story. Our kids need to know what the process is, and then they feel safe, they feel secure and comfortable, and it's going to go well. Um, there are always going to be um, changes, there are going to be differences, there's going to be Christmas Eve, there's going to be the night before the birthday, the sleepover with the friends. And especially as our kids are older, they can handle those a little bit better. But again, even if there is something different, you've traveled to visit a relative, the room might be different, but try to keep all of those other pieces as same as you possibly can. The bedtime, the steps to the routine, the favorite blankie or lovey or pajamas, whatever might be that you can have available to you to keep it the same as much as possible. Um, those calming items can be, people are concerned that they can be a crutch. My child is 7, they don't need this anymore, but sometimes they just really provide a layer of comfort and calm and um, security to the child that maybe they just really need. I can't have my mommy, I can't have my daddy here with me in bed, but I have this, my blankie, I have my lammy, whatever it might be, that they can always have with them at bedtime, and feel safe and comfortable having that with them. We do want to make sure that we are helping our kids get the amount of sleep, because not getting that full night's sleep doesn't just mean a cranky kid tomorrow. It doesn't just mean, oh, that was a rough time and we're going to be better. It can have lasting effects for our children. The behavior problems, children who are not getting enough sleep, they're cranky, they're irritable. They may have a poor impulse control, so they're going to be more likely to react aggressively to somebody if they're annoyed or unhappy. Hyperactivity, you'd think that, oh, they didn't sleep well, so they're going to be sleepy and lethargic today. And sometimes it can be the opposite. You know, there are chemicals surging through the body that, you know, I don't have enough sleep and it's not quite right. And it can be actually stimulating to the child. And it can look like ADHD. It can be inattention, hyperactivity. It can be all of those factors that looks a lot like ADHD. Um, Cognitive performance, children who are not getting enough sleep tend to perform poorer at school, have more difficulty remembering things, have difficulty following the topic in the class. The cognitive function is decreased, so they're not able to process in new information as well as they would otherwise. It can cause obesity, eating disorders. You know, kids who are not getting enough sleep can be accident prone. They can be more likely to injure themselves. It can contribute to mood swings, temper tantrums. You know, families say, well, there was nothing to it. You know, we don't know what happened or we don't know why. Maybe the child is just overtired and hit their limit and have no other way to release um, that stress there. And then, of course, the outer reach of the stress on the family. The siblings are fighting with each other. The parents, mom and dad, are tired because they didn't get a good night's sleep. They're irritable with each other. I was up with the child 4 times last night. You know, there's a lot of back and forth there. So really, the investment in getting your child on a good sleep routine, getting them into that pattern of meeting that need can really have a lasting effect on the whole family unit. And then autism spectrum disorder and sleep. Our kids with autism usually do have more sleep problems than other kids who are more typically developed. There may be more issues with regression or difficulty adapting to the patterns or routines. Um, there may be well, the parents are getting less sleep too, you know, if the child is up and down, you know, you're not going to be sleeping as well. Parents very often of children with ASD are worried about putting alarms on doors, putting bells on doors, so that if their child is up and moving around, they tend to be very on high alert all the time, which is contributing to a constant stress level throughout their day. And so that's very physically and emotionally, mentally rough on the family as well. And then it can intensify the sensory issues that they're already dealing with. You know, the auditory sensitivity, you know, loud noises, persistent noises can be frustrating and upsetting, and this can just magnify that. The tactile sensory, you know, pins and needles all over the skin or needing for deep pressure to soothe or help calm down. Sometimes those can be increased if your child is not getting enough sleep. Um, and then again, affecting learning and the cognitive functioning and behavioral factors as well.
After I take myself off mute there. So what we're going to talk about now is, well, thank you, Irene,
Yes.
for all that information. That was a great job. We're going to talk about insomnia and parasomnia. Okay, these are just the different things. If we just put it all in one, kids not getting to sleep. So what do we do, right? So we talk about sleep onset insomnia, and that is if it's just taking a long time to fall asleep, right? This is definitely the most common, and there are many different causes for this. We talk about sleep maintenance. They fall asleep fine, but man, they're waking up all the time, or they wake up early, or they're just not getting a good solid, block of sleep. Non-REM sleep, and these are the parasomnias. Are there other things that are kind of like internally going on that may not necessarily be caused by something that we could do kind of behaviorally? So sometimes these things, like bedwetting, sometimes there's medical needs, sometimes sleep terrors, which can be, fairly normal. Maybe they're problematic. Sleepwalking, things like that. What do we do to beat it, right? This is probably where most of you came for. Um, environmental interventions. We're going to talk about just different types of interventions, environmental, behavioral, and there'll be some other things. Obviously, we're not covering medical. Lighting, reduce light, easy, right? Increases melatonin, makes us sleepier. This would include, there's a lot of new data coming out about blue light, and blue light comes from maybe our screens, from our electronics. That gives a lot of times we talk about cues. If I'm waking up and the first thing I do is maybe grab my phone and take a look at it, it might be keeping me busy. It might be helping me keep my mind off something to where I can kind of slowly drift off again. However, is it doing something else that we can't normally see? Is it building up on other problems that might be happening? So we want to make sure that there's the lighting is our absolute best that we can accomplish. Do we have things covering the outside? Do we have something over our windows? If we just, if there's a super bright lights going on outside, are the hallways shut down? Is everyone kind of, keeping it nice and calm? The comfort, the bed area, is it safe? Is it cozy? As best as you can do. Some people, their sleeping areas are restricted. Is there something we can do to make it the most safe? If you're standing on a balance beam, right, you feel very uneasy. If I'm sleeping, I have that internal drive. I want to make sure that I'm safe, and my brain's going to let me know if I'm not feeling safe. So have we created some things that create that safety? Is it cozy? Are there some other cues like the blankie, like some of these other things that we can do? Noise and distractions, reduce them. Get rid of the phones, the iPads, the phones again, the tablets again. Those don't necessarily have to be one way, shape, or form, but all those electronics, those are very stimulating to kids. We see it all the time. And, with our children, they do so much with internally with the brain. It just really gets it all firing back up. And what we see and what studies show is that it has more of a detrimental effect. So you really want to control the amount of screen time you're having, not just young kids, but also as adults. Move their bed away from exterior walls where it might be noisy. You might live in a noisier neighborhood. You have close neighbors where there's, maybe if your bedtime's at 9 o'clock, but there's something going on in the environment where it's noisier outside. What can you do, right? You're stuck in a situation. What can you do to assist with that? I know some people run dishwashers. They have white noise machines, that kind of creates it muffles out some of that other stuff. And routine, right? You want to make sure that you have a working bedtime routine, that there is something very cut and dry. We do this, we do this, we do this, we do this to get ready for sleep. As Irene mentioned, visual schedules can be very, very powerful. There's probably a lot of different examples online. Just look and ask. I find a ton of resources. Go to Pinterest, you can go to YouTube, you can go to a lot of different resources to get these. Behavioral interventions, there's lots of studies to support this. You are not going to be harming your child when you're doing things like this correctly, okay? But do get support, do something that is research-based, that someone has written about and you've talked to maybe your doctor or some support about. Getting them to accept bedtime, hey, it's bedtime, everything's great. As a behavioral analyst, attention, kids love attention. Nighttime can be the very best time that they can get that attention from you or from somebody else, right? What happens when everyone goes away? They can kind of freak out. So how do we create that attachment? If you say, or detachment, should I say, when you say it's time for bed, does it all break loose, right? Does the levees break and everything kind of goes haywire? How do we create that so it's not like that stimulus and that cue of like, oh, I'm going to start throwing this tantrum, so that I can delay, right? It's kind of like your substitute teachers in your classroom and you start to bring up an off topic, and all of a sudden, you're delaying the lesson plan from even happening. And by the end of the class, you've done nothing. It's kind of the same way. When you say it's time for bed, how does that transition happen? The biggest thing is to build skills during the day. If your child is not listening to you during the day, they're not going to be listening to you at night, right? Do they respond to different praise and activities, treats and privileges, choices, charts and token systems? Let's say, you're going to want to start where they're at, right? Most good teachers know this. Meet the child where they're at. If you're just struggle bus big time, and you're having a lot of compliance issues, don't expect to just start to implement these things that you see here, that you read. Don't expect, immediate compliance within a day or two, like it says. Well, the research says this, it must be bunk research. Work on compliance, work on some of that relationship training during the day. Are they following what you're saying? Are you chasing them all the way around? Well, guess what? They're going to be running around your house at night. Okay. Staying in bed. Planned ignoring. Right? Pardon my dogs here. Using planned ignoring. Don't bite on whining and tantruming. Obviously, okay. So all things considered, if we're not worried about medical stuff and all those things are taken care of and we're on the right track, don't bite on the whining and tantruming. Right? They're going to be saying how mean you are, doing these other things, and they're just going to cry. Right? I'm reminded of that. There's a Super Nanny episode that you can find easily on YouTube where they talk about slowly, kind of gradually getting them more away from the child, returning the child to bed, picking them up, putting them right back in their bed, not saying anything, not giving them any attention, but we're there to keep them safe, right? That can be just as hard on the adult as it is on the child. So definitely keep that in mind. Build the motivation to sleep. Make it worthwhile. If sleep feels good and you can ingrain that in your child, everyone sleeps, this is amazing, this is great, it feels nice, then you are able to create that motivation for the kid to go to sleep. And they're gonna want to after a while, right? Let's see. We want to create the bedtime cues, right? So the dinner time, all the phones are going off, all that stuff, right? We're going to read a story. We're going to lay in bed. We're going to give them a little bit of attention before they go to bed by reading a story. Maybe I know that teachers will love me saying that. Read to your child every single night. That's just beneficial in so many areas. And then you're going to reward sleep behavior. It is okay to reward something that they're supposed to do on their own, right? Make them feel good about doing that. That's just going to benefit you in the long run. Falling asleep and staying asleep alone. Compliance and self-calming. There's going to be appropriate pairing and cues and getting ready for bed, which is, again, creating motivation. You're going to build compliance throughout the day. Build motivation. Maybe you're reading social stories. Maybe you're doing things like having the child or older toddler or somebody help create the chart and select the prizes or select the rewards that they're going to have. Maybe they're helping set up their bedroom. They're picking new, bed sheets or animals. They're having a say in this. We do that a lot of times in toilet training as well. Creating cues, right? Natural transitions that are very clearly easy to see. If, just like in schools, if a child learns and they've been taught that they can kind of wiggle around all these little, mom says it's time for bed or dad says it's time for bed, but it's really not. Normally that means 15 minutes. And then when they say, I mean it, that means an extra 10 minutes, right? So teach them that, now means now, and then reinforce them for doing that. Hey, popping in, hey, I really appreciate how you went to bed. I really, it makes me feel nice. I really love how you do that. Then you talk about identifying and eliminate the cues that work against you, right? Taking a step back. Hey, I've got it all under control, but it's just not working. Okay, write it down. Have someone help you out. Here's some of the things that are going on. This is happening. Maybe there's a last minute show that they really like, but boy, it starts at 10 o'clock. If let's just say bedtime's at 9, we start a show or they find something on, it's like, 8:45 or something, and they're going to take that show. It's going to take them all the way through past their bedtime. So eliminate some of those things that are happening there. Bedtime fading. If your child is just having a difficult time getting to sleep, it is okay to bump that back a little bit. Let's make the bedtime closer to 10 o'clock. If they're like at midnight, maybe make it at 11. And then, day by day, think about little increments. I'm going to chip it back, get it closer to that 9 o'clock deadline. So if we're talking about fading, the biggest things, make sure that the routine's in place, leave them awake in the crib, and then you can check in. You can just kind of show your face, maybe poke your head in. Don't look at them. You're not going to give them any attention. You don't have to talk to them. You don't have to respond to anything they're doing. Definitely not threatening them. I said go to bed, nothing like that. That negative attention can be positive attention for them. This, if we're talking about the fading, that usually takes about 1 to 2 weeks, okay? As we're going to get into, I kind of go backwards, but there's that cold turkey approach. Just leave them alone and cry it out. That is the most effective and the quickest way possible, if all things are considered. to get the results of the sleep schedule. However, that is very hard. That is very hard. It's taxing. I have 3 children myself, and I've done all 3 children different ways. They sleep well now. So do what's best for you, right? Again, we talk about this as a team approach. Graduated extinction. We're going to, again, the routine's in place. We're leaving them awake in the crib. They're going to stay there until, I'm going to stay there until they're asleep. Verbal reassurance. Hey, you're doing a nice job. Thank you so much. And then you're slowly going to move away from the crib each night. That's kind of like a fading process. Sometimes that's great for our own social emotional needs. And a lot of times, though, that helps the baby. It's kind of just that stretching that out a little bit. And again, that's kind of a 1 to 2 week process. And then the cold turkey. You know, a lot of people say this is just it, and they're fine with that. That is statistically the most effective. It's faster, but it is very difficult. You know, so don't think you have to do one way or the other. There's probably a middle ground in there somewhere. The biggest thing is to have a team approach and have a plan. Again, this may cause vomiting and aggression. You know, an extinction burst, that's common terminology in my field, but that just basically means, you know, if the old story kind of goes that I've used for years, you know, if I'm at a pop machine and and the pop machine's broken, but every time I hit a button, I get a pop without paying any money. Then what happens? I go to that pop machine, I go to that pop machine, I go to the pop machine. Someone comes and fixes the pop machine. I'm going to hit the button. No pop's going to come out. And I'm going to kind of freak out a little bit. I'm going to slam on the button. I'm going to shake the machine a little bit until I realize they must have fixed the machine. And that's when I'm going to stop pushing that button. So the same is going to happen with behavior. They're going to see, okay, whoa, there's a new sheriff in town. Now there's business. So what are we going to do? They're going to push the buttons, cry. They may say some things that are hurtful. You know, no one likes to hear the baby cry. But again, once you kind of have that, once you have that internal and you validate yourself, right? There's a book that we use that they coins the phrase, you know, giving your child the gift of sleep. You know, kind of flips that on its edge, twists it a little bit. Work through those tough times. You are enabling your child to have a lifelong skill that is extremely important to their well-being. And then obviously other factors, medical or physiological, talk to your doctor. Creating cues. I've used this word, cues, this term a lot. Parents are laying with them to calm them. TV music, lights on. These are all examples. Engaging in repetitive behaviors. These typically result in poor sleep. Parents should usually need to come and get back to sleep, like they don't have good sleep, right? It can get them to sleep. It might help calming them. But if you're training them that in order to get to sleep peacefully, mom or dad has to be there, brother, sister's got to be there. This has to happen. This has to happen. If I'm training them that these things need to happen in order to get to sleep, when those things are removed, they don't know what to do on their own when those things are removed. So these are things that might work against you. Here's things that can work for you. Remember, baby steps, right? Decrease and remove the physical touch and the proximity, okay? And including any of the attention, right? We can have eyes on, but we don't need to verbally say anything. We can just become very boring, right? And that is okay. Again, it's just kind of a cold turkey there. Right as the child is almost asleep, routine is done. This is called the be right back method, right? Hey, you're almost asleep. I'll be right back. I'm going to go check on something, and I'll be right back, right? You can come right back. You can check on them. You can be, you know, to your word. Slowly, you can increase the amount of times that you increase the duration of time that you're out. Hey, I've got to go downstairs and I have to do 2 things, and you're gone for like 2 minutes the next night, and then 3 minutes, and so on. And that kind of gives you the time, and they know you're coming back, so they're assured. That kind of, you know, creates that internal sense of relaxation for them, and they still get to sleep. If they wake up and they give them very little comfort or attention, get them right back to bed, soothe them, maybe pat them on the head, and that's it, right? Return them immediately to their bed, no talking, eye contact, definitely not any reprimanding. Do not add food or anything like that, okay? Night terrors. Night terrors usually occur in the first 1 to 4 hours of sleep. Children normally can't be woken from these things. It might be writhing around, they might be screaming or yelling. You can definitely support them and keep them safe, but just wait it out, right? If it happens over and over again, you're definitely going to want to see your doctor about it. Common causes, you know, stress, anxiety, sickness, jet lag, chronic overtiredness. And usually the children don't remember these things. When we talk about nightmares, these are bad dreams that cause someone to wake up. Usually, you wake up in the middle of your sleep, maybe you're, stressing, you're sweating. Usually occurs in the second half of sleep. You normally can wake them from this. Obviously, you're not going to try to wake from a night terror. You're not going to try necessarily, but if you wanted to try, you could wake them out of it, right? That's the difference there. Again, commonly caused by the same things: overtiredness, growing imagination, specific books or videos, and scary encounters. This is where you're going to want to be aware of, what did my child have access to? I remember a game, Five Nights at Freddy's. They're a very common game. That's, they're jump scaring. And some of those things, the kid may not be legitimately scared of that, but it could be causing a stir in their system, especially if they're watching that a little later towards the night, towards their sleep schedule. That could be having an ill effect. So if we're talking about beating these things, night terrors, be patient, don't try to wake them. Keep the children safe and continue with the routine the next night, right? Again, if it's several nights in a row, you're going to talk to your doctor. Nightmares, reassure your children that's only a dream and get them back to their own beds. Letting them stay with you might be reinforcing that, I guess an easier way to say it is, if you start letting your kids be with you because you believe it's calming to them after their nightmares, you might notice that they're having nightmares more frequently. Maybe they're not, maybe they are, but it might be one of those things where you're trying to do something positive socio-emotionally, but you're actually working against yourself. So get them back to their bed, reassure them it's okay, you can listen to them. Don't try to psychoanalyze it, right? 3 a.m. is not the time to talk about the dreams. Oh man, that sounds very concerning. I'd love to talk to you about it in the morning, sweetie. Remember, I'm safe. You're safe here. Everything's safe, and you might need to spend a little bit extra time in there, but don't give them too much attention. And then avoid scary things, obviously. Bedwetting usually gets better on its own. Reduce the liquids after dinner. Address constipation with medical help. Alarm clock training. If your child is bedwetting, you know what time that they are usually having these situations. Remember, we talked about the mode of sleep there. If you can time it well, you can set your own alarm to go up and maybe bring them to the bathroom at a certain time of the night. Wetting alarms, these are a little bit intrusive. I believe there's many types of these. These would be an alarm that would sense some wet pants or wet bed, and then they would wake the child up so that they could go themselves and relieve themselves. Sleep-related disorders, talk about apneas. Some snoring is okay and natural. Regular snoring, mouth breathing, maybe apnea, and needs attention. Talk to your pediatrician if you do have concerns. Sleep study can check on ferritin levels. A lot of times you have kids who are having trouble getting sleep. That might be indicative of low iron levels. So your pediatrician might consider some iron supplements for you. Children with ASD tend to have restricted diets and may have lower iron. We talk about disorders in sleep. Restless leg syndrome, periodic limb movement disorder, can be associated again with low iron levels. Narcolepsy, sleep paralysis, hallucinations, cataplexy. These are all things you're going to talk to your doctor about. Sleep stealers, these are things that are kind of sometimes out of your control. Talk to your doctor. We said this all over the place, right? Apnea, anxiety. If this is problematic, obviously, if you have a big day in the morning, do some things, some self-talk, some calming. One thing that I did that seemed to really go well, you never know what your kind of day your child is having. So we would ask them, stay in bed with them, and we would ask them, tell me 3 things. What went well today? What didn't go so well today? What could you do differently tomorrow? And you can leave them wide open. You don't have to engage them. Oh, Johnny was mean to me. Oh, tell me about that. You might have a couple of questions, but you might have get the basics off their chest. But then if they see something like really alarming, that might be the time to address it. However, if it sounds kind of basic, their typical thing, I got into a fight with Susie, or Johnny was mean to me, or something like that, you can go through a couple of different things, maybe get a couple of different options for them to plan for the next day. Again, that kind of feeds right into question number 3, what can you do differently tomorrow? It kind of gives them a positive spin on it, sets them into bed, hopefully reducing that anxiety. So Irene will take us into the next part.
If I can find my mute button. There we go. Um, what else is there? What else can we do? My friend gives my children melatonin every night and says they sleep wonderfully. There are a lot of supplements. There's a lot of conversations about melatonin or Benadryl or CBD or other sleep aids. Those really become another level that should be discussed with your doctor. A recurring theme here. Usually if it comes to a point where you feel like sleep is not happening without taking it to this degree, then you really should be having a conversation with the doctor, the pediatrician, or whoever is providing that health care for your child, because any of those other factors that Jeremy has touched over may be a factor, and you want to get that taken care of rather than putting this little mild band-aid on a symptom of what might be a bigger cause here. Um, with that said, what else can we do? The routine, the consistency, the schedule. We also have diet. What you eat and can, throughout the whole day can play a role in how well you sleep. Proteins, carbohydrates tend to actually be slower to digest. And so rather than having sugary foods, rather than having sweets before bed, a cheese stick, an apple with peanut butter, those might be better things to have as a bedtime snack to kind of fill the stomach and help keep that hunger from spiking back up before morning time. However, also having a really big meal right before bed can interfere with having a good night's sleep while the body is working hard to digest all the food. Interesting thing as I was doing some research for this is a lot of different sources talk about tryptophans. We all know the turkey dinner, Thanksgiving dinner, and everybody wants to take a nap. There is something to be said for foods that are rich in tryptophans can help with sleep. Um, the sugary foods, though, those cause the insulin levels to spike and then fall dramatically. You may actually feel more hungry in a shorter period of time. The body is working hard to keep that insulin level stable, so those can have a negative impact on a good sleep. Um, so those, and then exercise. Kids who are more active during the day do tend to fall asleep faster and stay asleep longer than kids who are sedentary. So the kids who are indoors watching TV, playing video games, really need to have movement breaks throughout the day. Go and run around the yard 15 times, or let's kick the soccer ball around the yard, take a bike ride, just a little bit of extra movement, as little as 20 minutes, 30 minutes per day, can make a really nice impact on improving sleep. With that said, if you are having a lot of high activity right before sleep, now your heart's racing, a little bit of adrenaline is running, and that's not a good time to exercise, be active, because that will make it harder to settle down and fall asleep. So, activity throughout the day, just avoid it right before bedtime. Um, Removing electronics. A lot of families are, kids have TVs in their room, they have their own tablets, they have their video game systems. It's a really good thing to remove those, take the remote control away, unplug the TV, remove the tablets at bedtime so that the children are not tempted to turn those screens on. Jeremy talked about the blue lights, the stimulation from the lights, from the activity in the game that they're playing, the video that they're watching, can be a detriment to that good night's sleep. It can cause them to stay up later than they intend to. It's so easy to say, oh, just 5 more minutes to finish this one. And then the next level automatically starts, or the next video automatically starts. And before you know it, it's a whole lot later. So taking those away would be helpful. Having the object, having the lovey, can be comforting for a younger child to have to cuddle to sleep. Just be prepared to make sure that it's available. Some people may even be so specific as to say, this is for bed only. Don't take it out of the bedroom, don't take it out of the bed. That solves the problem of having to hunt for it at bedtime. It also reduces the risk of it getting lost, and then we don't have that lovey at night, and we can't get to sleep without the lovey. So that just be aware of that if you do have a special object for bedtime. Some people really like to have, the salt lamps are coming into, being are very popular these days. White noise machines are very popular. There's what else was I thinking of? There are, lavender scents. People will spray a fragrance on the bed sheets or something before bed. Those can be very helpful to a lot of people. Those are anecdotal. There really isn't a lot of research that can say these are definitely going to help with sleep. And a lot of times it just might be an association factor. Again, that salt lamp is only in the bedroom. They're not, having that around the house during other parts of the day. So having that come on, again, just kind of helps flip that switch to this is time to sleep. Having the white noise kind of drowns out the other background noises. That helps a lot to eliminate the distraction of the older siblings who might be up or doing things, or the parents' TV, in the room right next to their bedroom, if it might be the case. And then those are things that can be on a case by case helpful to a family, but not necessarily proven to help anybody and everybody with sleep. It depends on how you use them. I think, yeah, there we go.
There we are. Okay. This is just a worksite presentation. Um, all the things we got from here. Again, when we sat, we went over this. We were, so lucky to sit and do the research for these things. There were just some excellent YouTube clips where we got these videos from. A lot of the slides are very, very similar. Why recreate the wheel? These are medically proven interventions. So this common sleep problems for children comes from the Freeman Health Center in Kansas City. Sleep 101 for children with autism. Okay, these are both medical doctors that give those. 2-year-old sleep training, how to avoid common sleep problems. Here's the website it came from there. And then I threw a Super Nanny clip in here. We use that a lot for our trainings, but it kind of just shows you some of the emotional tolls it can take to kind of fade away from that. We got the plan. This is easy. Yet when it comes time, when everyone's exhausted. So this is kind of the plan in action there. These are just other helpful resources. So within a lot of those videos that I told you about, they cited some of these studies and papers and or books that they come from. Solving sleep problems with children with autism, Sleep Better, a guide to improving sleep, guide to your child's sleep, take charge of your child's sleep, sleeping through the night. Okay, use resources. Don't go off of word of mouth, unless that word of mouth, I guess, unless that person you're speaking to is a doctor or is someone in the field with that knowledge. And these are just other helpful parenting resources. We talked about sleep being something throughout the day. If you need to do compliance training and behavioral training throughout your day to get your child used to that, following through and they feel safe and they feel supported and, you've kind of got that system and family, all that togetherness has been addressed, you're going to get better sleep. It's going to be very helpful to create that sleep pattern, that routine at night. So take a look at some of these. I know my wife and I just read these and we followed this to the T, and it really, we found some dramatic effects. I know other parents who went the opposite route of these and it wasn't for them. They still found benefits in there. So use what you're comfortable with, but I did want to cite these. And then this is a really great book. I know Elizabeth's on here. I gave it to her. I got these from one of my fantastic colleagues years ago when I was working in the schools. Just talks about, how to handle these temper tantrums, how to handle things, in our world. What's the function of their behavior? What are some things so that when I go in, I'm not psychoanalyzing everything. I'm not wondering what's wrong with my kid. I'm a bad parent. You're not judging yourself. So take a look at all these things. Maybe this is a quick read. I think on Amazon, this is $5 you can check it out for. And then I did want to guide you. Again, this is a weekly thing. Next week, I'll be back on, hopefully for a shorter amount of time, going over eating problems or eating issues with kids. This link will take you right to our website, the Health West website. I believe they're going to load this up on YouTube. And then there will also be a copy of this slideshow, this PowerPoint, so that you can get some of the resources off there. I've got the direct links there. Hopefully, once we post that, then you can just click on the link. It'll take you right to where you need to go. And that is everything that we have for you.
Any
So
questions?
I hope,
Oh,
yeah, any questions?
I think we're good.
Awesome. Okay. Well, it's been a pleasure. Thank you very much for sticking it out with us, and we will talk to you soon.
Thanks.